Chlamydia is one of the most widespread sexually transmitted infections affecting women globally. It is a bacterial infection caused by a specific organism called Chlamydia trachomatis. This infection is a major public health concern, not only due to its high prevalence, but also because it is frequently a silent disease. This means it often exists without any obvious signs or symptoms, allowing it to be unknowingly passed between partners. If left untreated, chlamydia can cause serious, long-term, and irreversible damage to a woman's reproductive system. The emotional and physical toll of its complications, from chronic pain to the loss of fertility, makes understanding this stealthy infection a critical step in protecting your health, your fertility, and your future. How chlamydia spreads and why it starts. The primary cause of a chlamydial infection is the bacterium Chlamydia trachomatis. It is transmitted almost exclusively through sexual contact. This includes unprotected vaginal, anal, or oral sex with someone who has the infection. The bacteria thrive in the warm, moist environment of the mucous membranes, which is why they commonly infect areas like the cervix, urethra, rectum, and sometimes the throat. A very important mode of transmission for women to be aware of is vertical transmission. This is when an infected mother passes the bacteria to her baby during vaginal delivery. In newborns, this can lead to serious eye infections, a condition called neonatal conjunctivitis, which typically appears 5 to 14 days after birth, and pneumonia, which can develop several weeks later. Early detection and treatment of chlamydia in pregnancy is the best way to prevent this. It is crucial to dispel common myths about how chlamydia is spread. You cannot get chlamydia from casual contact. The bacteria cannot survive for long outside the human body, so it is not transmitted through hugging, sharing food or drinks, using the same towels, or from toilet seats. The risk comes from direct sexual contact with an infected person's bodily fluids. Your risk increases if you have a new sexual partner or multiple sexual partners. Young women, especially those under the age of 25, are biologically more susceptible to the infection. This is because the cervix in younger women has a larger area of vulnerable cells, often called the transformation zone, which has not yet fully matured. These cells are more easily invaded by the bacteria. As a woman ages, this zone recedes and the cells become more robust and resistant. The clinical journey of the infection in a woman's body. The way chlamydia progresses in a woman's body, its clinical course is often dangerously quiet. After you are exposed to the bacteria, there is an incubation period that typically lasts from 1 to 3 weeks before any potential symptoms might appear. However, the majority of women, estimated to be around 70%, will never experience any symptoms at all, allowing the infection to quietly advance and cause harm without any warning. For a woman, the infection typically begins in the cervix, the lower part of the uterus that opens into the vagina. This initial infection is called cervicitis. The bacteria infect the cells of the cervix, causing inflammation. If it is not diagnosed and treated at this early stage, the bacteria can begin an upward journey. This upward migration is where the most severe damage occurs. The bacteria can travel from the cervix into the uterus and then into the fallopian tubes, the delicate tubes that carry eggs from the ovaries to the uterus. When the infection reaches the upper reproductive tract, it can cause a serious condition called pelvic inflammatory disease, or PID. PID is a severe inflammation of a woman's reproductive organs. The body's own immune response, in its attempt to fight the bacteria, contributes to this inflammation and tissue damage. It can cause the fallopian tubes to become scarred and blocked. This scarring can have devastating and permanent consequences. It is a leading cause of infertility in women because it can prevent an egg from traveling down the fallopian tube to be fertilized, or it can block a fertilized egg from reaching the uterus. This scarring also dramatically increases the risk of an ectopic pregnancy. This is a life-threatening condition where a fertilized egg implants and grows outside the uterus, most often in a scarred and narrowed fallopian tube. A fallopian tube cannot stretch like the uterus and will eventually rupture, causing massive internal bleeding that is a medical emergency. PID can also lead to chronic, debilitating pelvic pain that can last for years, long after the infection is gone. This pain can manifest as a constant dull ache, sharp stabbing pains, or deep pain during intercourse, profoundly impacting a woman's quality of life, mental health, and relationships. Recognizing the symptoms, if they appear. Because chlamydia is so often asymptomatic, You cannot rely on waiting for symptoms to appear before getting checked. Routine screening is key. However, if symptoms do occur, it is vital to recognize them and seek medical attention immediately. For women, the potential warning signs may include an unusual vaginal discharge. It might be more copious than usual, have a yellowish color, or have a strong odor, a burning feeling when you urinate. This symptom is often mistaken for a urinary tract infection, which is why a proper test is crucial. Pain during sexual intercourse. This is medically known as dyspareunia, bleeding between your periods or after sex. Any unscheduled bleeding should always be investigated. Lower abdominal or pelvic pain. This can range from a dull ache to more severe pain and may be accompanied by nausea or fever, which are potential signs that the infection has progressed to pelvic inflammatory disease. In some cases, the inflammation from PID can spread to the lining of the liver, a condition known as Fitzhugh-Curtis syndrome. This can cause sharp pain in the upper right side of your abdomen, sometimes confused with gallbladder or liver problems. If the infection is located in the rectum from anal sex, symptoms can include rectal pain, discharge, or bleeding. An infection in the throat from oral sex is usually symptom-free but can occasionally cause a sore throat. Getting professional help, diagnosis, and testing. If you experience any of these symptoms or learn that a current or former sexual partner has tested positive for chlamydia, it is essential to see a healthcare provider. You can make an appointment with your gynecologist, a general family doctor, or visit a specialized sexual health or genitourinary medicine clinic. Getting tested for chlamydia is simple, accurate, and painless. The best and most common diagnostic method is a highly sensitive test called a nucleic acid amplification test, or NEAT. This test is the gold standard because it works by detecting the specific genetic material, the DNA, of the Chlamydia trachomatis bacteria. It can detect even very small amounts of bacteria, making it highly reliable. The testing process is not invasive. For women, the most accurate sample is a vaginal swab. In many clinics, you will be given the option to collect the swab sample yourself in a private restroom, a process that is quick and much more comfortable for many women than a full pelvic exam. A urine sample can also be used to test for chlamydia, though for women, the vaginal swab is generally considered slightly more reliable. If an infection of the rectum or throat is suspected, your doctor will use a soft swab to collect a sample from those areas. Treatment, recovery, and feeling better. One of the most important things to know about chlamydia is that it is completely curable with a short and simple course of antibiotics. It is a bacterial infection, and it responds very well to the right medication. The treatment guidelines recommended by major health organizations like the World Health Organization and the U.S. Centers for Disease Control and Prevention, or CDC, typically involve one of two antibiotic regimens, doxycycline. This is often the preferred first-line treatment. It involves taking a pill twice a day for 7 consecutive days. It has a very high cure rate. Azithromycin. This is an alternative treatment that is very convenient as it involves taking a single 1-gram dose of the antibiotic all at once. It is absolutely critical that you take the entire course of medication exactly as prescribed by your doctor, even if you start to feel better before it is finished. To ensure the treatment is effective and to prevent spreading the infection, you must abstain from all sexual activity for at least 7 days after your single-dose treatment or until you have completed your full 7-day course of doxycycline. To alleviate any discomfort during this time, you can use over-the-counter pain relievers for any pelvic pain. The most important step for relief, however, is completing the antibiotic course, which will eliminate the infection causing the symptoms. The rehabilitation, protecting yourself and your partners after treatment. The concept of rehabilitation after a chlamydia diagnosis centers on 2 crucial actions: preventing reinfection and stopping the chain of transmission. The first critical step is partner notification. You must inform all of your sexual partners from the last 60 days that they may have been exposed to chlamydia. This is not about blame, it is a vital public health measure. They need to get tested and treated, even if they have no symptoms. If they are not treated, they can suffer their own health complications, and you can become reinfected if you resume sexual activity with them. This creates a ping-pong effect of passing the infection back and forth. Acknowledging that this can be a difficult and anxious conversation is important. Many find it helpful to start by saying, "My doctor told me it's important I let you know," which can help remove a sense of personal accusation. If you are uncomfortable having this conversation, many public health departments offer anonymous partner notification services to help you. The second step is retesting. your doctor will recommend that you get tested again about 3 months after your treatment. This is not a test to see if the medicine worked. The cure rates are very high. Instead, this retest is to check for reinfection, which is unfortunately very common. Prevention, the best strategy for your health. The most powerful tool you have against chlamydia is prevention. The most effective way to avoid all sexually transmitted infections is to abstain from sex or to be in a long-term, mutually monogamous relationship with a partner who has been tested and is known to be uninfected. For sexually active women, the most important preventive measure is the consistent and correct use of condoms for every act of vaginal, anal, or oral sex. Condoms create a physical barrier that is highly effective at preventing the transmission of bacteria. Routine screening is the other pillar of prevention. Because chlamydia is so often silent, regular testing is the only way to find and treat it before it can cause long-term harm. The CDC recommends that all sexually active women under the age of 25 should be tested for chlamydia every year. Women who are 25 and older should also be tested if they have new or multiple sexual partners. Research and expert perspectives. The scientific community is actively working to find better ways to fight chlamydia. A primary goal of current research is the development of a chlamydia vaccine. A vaccine would be revolutionary, offering a way to prevent infections from ever taking hold and thereby protecting women from the devastating consequences of PID and infertility. Progress is being made, but the complex nature of the bacteria presents significant scientific challenges. Leading experts in sexual health consistently emphasize the importance of screening. Dr. Hunter Hansfield, a professor emeritus of medicine at the University of Washington Center for AIDS and STD, is a widely respected authority. He has stated, because most trachomatis infections are asymptomatic, control of the infection and its complications depends on screening asymptomatic persons at risk. This expert opinion highlights that we cannot wait for symptoms to act against this disease. Jen Gunter, a gynecologist and a prominent advocate for women's health, provides straightforward, evidence-based advice. In her book The Vagina Bible, she consistently empowers women with knowledge to take charge of their health, demystifying topics like STIs and stressing the importance of open communication with doctors and partners. The global medical community's consensus is clear. In the authoritative medical textbook Mandel, Douglas, and Bennett's Principles and Practice of Infectious Diseases, it is noted that chlamydia trachomatis is a major global health issue. The text provides a comprehensive look at the bacterium's impact, explaining that it is not just a cause of STIs but also of preventable blindness in other parts of the world. This underlines the seriousness of the organism and the importance of controlling its spread through education, screening, and prompt, effective treatment for both women and their partners.